A group of volunteers has been providing a vital resource for Canadians trying to find vaccine appointments. But now, Vaccine Hunters Canada is ready to wind down its operations. It'll stop posting to its popular social media accounts after August 31st. Instead, there will be an automated self-service tool on its website. It comes as many Canadians have already rolled up their sleeves. 81% of Canadians 12 and up have received at least one dose, while nearly 70% are fully vaccinated. Sabrina Craig is a director of Vaccine Hunters Canada, and she's in Toronto. Sabrina, first off, I just want to say congratulations on Vaccine Hunters. I like the name. It's also a great service, so congratulations on what you've been able to achieve so far. So now things are changing. Why now? Why is now the time to wind down your social media accounts and put the focus on this self-service tool?
So we actually did a poll earlier on this month, and we found that a lot of our followers have already been double vaccinated. So now we realize that the job isn't done. How we're solving the problem or how we're solving the issue here is changing and does need to change.
So describe the issue now that you're trying to deal with.
So this is within the vaccine rollout, and one of the things that we have done, we've been really happy to share and build on, is in between the health units, they're able to compare and contrast what they're doing in comparison to other similar health units and able to pull off the different types of events or strategies for their vaccine rollout. So we've been really happy about that, and also really gather a lot of data on how to get people to vaccination appointments and pop-ups and all that type of thing.
All right, so let's unpack the new thing a little bit. The first project, if I can call it that, was basically to get people connected to vaccines. If you can't get you don't know where they are, you want to get one, you helped out on that. Explain the self-service tool. How's it going to work? How can people access it? Walk us through what it's going to do.
Right. So the mission of Vaccine Hunters Canada is to connect eligible people in Canada to vaccines from coast to coast to coast. And we're still continuing to do that, and people can do that by going to our Find Your Immunization tool, FYI, at appointments.vaccinehunters.ca, or just go to vaccinehunters.ca and check out where they can get their appointments. We realize that reaching people who've not yet gotten vaccinated is a challenge. At the beginning of our vaccine journey, we actually had a lot of volume through our emails, and naturally that level of communication has slowed down, and we're feeling that that's the same outreach area slowdown that we're seeing on our Twitter and other socials.
Now,
so we really wanted to pivot and help people in the way that's easy for them, so that they don't have to go outside of what they might be comfortable with. With that being said, it's just an easy tool available in, I believe, 20 plus languages, where they can put in their postal code and find an appointment nearby.
So one of the great things that your work did was with the social media accounts was it took away, one barrier to getting vaccinated, and that was actually finding the vaccine appointments, right? But we know that other barriers still exist. For example, getting transportation, getting to a clinic, or childcare, for example, right? So what do you think? I mean, in your opinion, do governments need to do more to address those other barriers? I mean, and if so, how do you think they could go about doing that?
There's so many different strategies clinics can use to have a really efficient high turnout. And we've created a style guide so that they can see what type of things are out there and what type of cues that they can give to people to let them know that it's available, it's nearby. Just an anecdote from earlier, we had an email where someone had asked about a homebound vaccination for their parent, and they were wondering because they lived in a different town, the patient wasn't able to leave their house, but still had carers coming in who were not fully vaccinated, not vaccinated, getting vaccinated, but they were really concerned about their parent, and they didn't have any information on homebound vaccines. And we were able to open the conversation to the public saying, hey, by the way, if you are aware of a process for homebound vaccinations, what's worked for you and your family, please share it. And a couple days later, we saw on a handful of sites that there was outline processes for homebound vaccinations. So I think it is really, it's really great when you can see people working together and really building on the good that there is.
So when was it? Was it March, I think, that Vaccine Hunters Canada was begun?
Yeah.
I got to ask you, what was it like to be a part of that whole experience? I mean, it kind of exploded, right? Like it became mega. What was it like being in the center of it all for you?
I think that a lot of it really hasn't sunk in, like the media attention, the newspapers. I think when I have time to process it, maybe I'll have a better answer for it. But it's really been a really wonderful journey. And I think the best part about it is the connections the volunteers have made. The team is so great. And each of them bring such an interesting, unique perspective on their communities and on their personal insights from their career backgrounds. We have a handful of the volunteers who have health backgrounds, and they have really interesting insights on why things are done the way that they're done.
Is there a single favorite moment or memory that stands out for you?
So at the beginning, I was largely in charge of the pharmacy rollout, where it was AstraZeneca with over 55, and that's sometimes a challenging demographic to get out, especially through media communication. And we had a handful of desperate pharmacists who were very eager to get the vaccines out there, and to be able to hear from them that after we tweeted to the wide public that they had vaccines, that they had full clinics, and that's definitely really wonderful for us to hear.
No. And is there a lesson that you take away from it for yourself as you go forward? Has this changed you, do you think? I hate to get all philosophical on you, but I kind of want to know.
Oh yeah, there's so many lessons. I think when we talk about this role is really data focused, to look at the numbers, to look at the areas, and I think to take things slow and work on the data before you publish and promote things, to be able to target the needs of people where they're at.
Sabrina, it's been great chatting with you. I appreciate your time, and I just want to say congratulations again on the good work that you've been doing.
Thank you so much. From all of us at the team at Vaccine Hunters Canada, we so appreciate this. And if you haven't already gotten vaccinated, please consider doing so.
Thank you, Sabrina. We've got to run.
Hi, I'm Vashi Capellos, host of Power in Politics. See more of our show by subscribing to the CBC News channel or click the link for another video.